Health benefits of a sugar tax. According to the World Health Organization, sugary drinks are a major contributor to obesity and diabetes, and its consumption is increasing in most countries, especially amongst children and adolescents. In most countries, obesity is a major risk factor for heart diseases, cancers, and other diseases. This is why a tax on sugary drinks that rises prices by 20% can lead to a reduction in consumption of around 20%, thus preventing obesity and diabetes. We can observe in this diagram that the sugar intake per capita has a positive correlation with obesity prevalence in the United Kingdom and the United States over the past centuries. Rising obesity and diabetes rates are taking a heavy toll on both the health system and the overall economy of a country. We can observe higher disability rates, lower productivity, and costs of comorbidity caused by these two conditions. From 2011 to 2030, losses in gross domestic product worldwide due to diabetes, including both direct and indirect costs, are expected to total $1.7 trillion US. Half of it, around 900 billion in high-income countries, and the other half, around $800 billion in low and middle-income countries. Some studies have shown that a sugar tax could reduce death from diabetes, heart disease, and stroke, and lead to reduced healthcare spending and out-of-pocket payments on health. A 20% tax on sugar-sweetened drinks is also estimated to reduce the number of obese adults in the UK by 1.3%, or the equivalent of 180,000 people, and the number who are overweight by 0.9%, or 285,000 people. Following the introduction of a tax on sugar-sweetened drinks of 10% in Mexico, an overall average 6% reduction in purchases of sugar-sweetened drinks was seen in 2014, with higher reductions in purchasing of around 9% on average being seen in lower socioeconomic households. So we see that a sugar tax could have positive effects, not only in developing countries, but also in developed countries. Finally, revenue generated by a sugar tax could be spent to improve healthcare systems, encourage healthier diets, increase physical activity, and build capacity for effective tax administration, further increasing the value of this measure.
Why is an impact evaluation required? The impact evaluation will support us and help us define the key evaluation questions, timelines, and available resources. It will provide information about what is needed to make the intervention work for different groups in different settings. It will collect evidence and give information on which bits work and which don't. It will help us understand and engage with stakeholders involved in the process, such as decision makers, industry, health groups, and consumers, and define as well the context in which the policy would be applied. An impact evaluation is required to provide input on the methodology, build credibility around the policy, and enhance accountability for resources invested. It will inform decision makers about whether to scale up the intervention. And, importantly, it will monitor the compliance of the policy, measure the positive or negative effect, as well as include an analysis of what caused the effects. Lastly, it will evaluate the risks of implementation, such as lack of resources, lack of strong evidence or access to data, and define the limitations of the impact evaluation.
The first step to design our evaluation strategy is to create a result chain. The results chain is composed of 5 different elements. The first one, input, is mostly composed of financial costs, such as cost of collecting taxes, but as well as human resources costs. The second element is the activities, in particular the implementation, promotion of the intervention and collection of the tax, public campaigns, or monitoring and evaluation activities. Thirdly, our activities will result in outputs, such as higher price of unhealthy food and beverage, change in composition of food and beverage by the industry. Finally, our policy will have direct outcomes and final outcomes. The outcomes could be decrease in sales of unhealthy food and sugary beverage and reduction of consumption of unhealthy food and beverage by the population. These resulting in our final outcome, which is the improved population health and decreased cost of healthcare. Based on our result chain, we can now design our evaluation strategy. The main outcome of the evaluation is the decrease in obesity rates to improve the population health and lead to diminution of cardiovascular and disease and diabetes. The assumption that will be tested is that the tax increase will lead to change in consumption rates and result in improved health outcomes for the population. Our issue or our evaluation problem is that many other factors apart from the tax can influence the final outcome, which is the increased population health. Finally, our data used or collected are the household purchasing data of unhealthy beverage and food, as well as obesity rates.
The study design and analysis is an important part of our evaluation strategy. The preferred method for this impact evaluation is difference in difference, because it eliminates the fixed difference not related to the program and looks at the subsequent gains of the intervention group and the comparison group in 2 times period before and after the policy took place. The estimated counterfactual outcome is the comparison group's change over time from its baseline mean. Therefore, baseline information will be collected to compare the effect of the policy. A pilot will be conducted in one region of the country for a period of 2 years. The comparison group will be another region with similar characteristics where the tax is not being implemented. As far as the data collection and analysis is concerned, we will have a mix of qualitative and quantitative data to increase the credibility of the findings and answer the key evaluation questions, as well as we'll define the sample technique selection. The outcome variables and indicator is as follows. Changes in product prices, beverages and food sales, household spending changes, shopping patterns, differential changes by socioeconomic group, BMI and pre-tax purchase volume is the variables we're going to look, and it will help us develop an estimate of what would have happened without the intervention and compare the findings of what has happened with the intervention. Last but not least, the potential threats to the validity of our methodology would be unobserved characteristics of households, such as preference for certain types of food or beverages, and the seasonality of purchase. For example, during colder seasons, less ice cream or cold beverage may be purchased. Another element is to check that there might not be a change in the pattern of consumption, and it could be possible that we'll not be able to observe whether and how the marketing strategies, such as advertisement, might have changed after the announcement and implementation of the tax policy.